Hello, everyone. Please let me tell you a few words about my 12 months progress on my PhD topic, which is comparison of hormonal contraceptive methods and the route of administration. I'm Gábor Vleskó, and I work as a specialist at the Obstetrics and Gynecology clinic. My vision is to expand knowledge on contraception in the world so that every woman can avoid unwanted pregnancy. And the mission to reach this is to find new information that can help women to choose the best option for contraception. I have two ongoing projects. Both are systematic review and meta-analysis. The first is about the efficacy and safety of combined parenteral and oral contraceptives. And the second one is investigating the role of obesity on hormonal contraceptives. The first project, let me tell you a few words about the background. We know that almost 2 billion women are in a reproductive age, and that over 150 million use contraceptive pills. So there's room for other methods. And we also know from trials that the effectiveness of a contraceptive methods highly depends on the compliance with the regimen. They found that every second patient tended to miss 3 or even more pills if taking contraceptive pills. So the aim is to investigate the efficacy, the cycle control, the compliance, and the adverse events associated with the parenteral contraceptive methods. So the question is that, are these combined parenteral contraceptive methods as effective as oral contraceptive? We had the PICO framework with women of reproductive age. The intervention was a parenteral contraceptive patch and the ring, so the transdermal patch and the vaginal ring. As comparative, we had combined oral contraceptives. The primary outcome was Pearl index, so the efficacy, and the secondary outcomes we had compliance, adverse events. The hypothesis was that the parenteral administration of these drugs is preferable to the oral route. We performed a systematic search at the end of November with the following search key, and we only included randomized controlled trials. At the end of selection, we had 13 eligible articles. About the results, Pearl index, efficacy was our primary outcome. Pearl index is an index which indicates the efficacy of contraceptive methods. Theoretically, it ranges between 0, so if it would be a perfect method is 0, and if no contraception is used, it's around 80. So the lower numbers we have, the better contraceptive efficacy we face. We found the outcome measure was mean difference, and we found that there's no difference between the oral and the parenteral use of hormones, which means we can suggest both methods for contraception safely. Checking for compliance, we were curious about this, and we found that there is better compliance with parenteral methods. And we also found that between the parenteral methods, the patch and the ring, there was a significant subgroup difference in favor of the patch. So it is, so it can be advisable for those ladies looking for or who tend to miss pills or forget vaginal rings, or being afraid of losing a vaginal ring. A patch might be a good alternative with the same efficacy, but with better compliance. Speaking about adverse events, breast discomfort is one we checked for, and we found that altogether the parenteral methods have a slightly higher risk of breast discomfort. And we also found that somehow the patch had a significantly higher breast discomfort rate. So it means that if you have a women with previous history or discontinuation with connected to breast discomfort, or they have a fear from breast pain or breast discomfort, we will not suggest these methods. We will stay with others or with the combined oral contraceptives. About these two, nausea and vomiting, they are common, and we found that the odds ratio was around 1, so you found no difference between the oral and the parenteral ways, although we found a significant subgroup difference between the transdermal patch and the ring. So this way we can also choose between the methods. We checked for vaginal discharge, which is also a common symptom in case of the ring, the vaginal ring. And we found what we expected, that there is a significantly higher risk of vaginal discharge. So we should always inform patients that using a vaginal ring might have advantages, but they might experience an increased risk for vaginal discharge. The strength of our study is that we only included randomized control trials, and this is a comprehensive analysis of the different administration methods. We also have limitations because there was only one direct ring versus patch comparison. So they either compared the ring to the oral or the patch to the oral, but there was one, and there's no uniform way to report compliance and adverse events. So the conclusion is that the contraceptive efficacy is similar in both way of administration, but a personalized choice can be offered to patients tailored to the patient's needs. The implication for practice is that personalized contraceptive use can be made, and we might look for better compliance and no discontinuation of these contraceptive methods. Because if someone discontinues, maybe she won't ever start again or regain the faith. The implication for research, we might try different drug types and also make the direct comparison of the application forms, and also different application forms might be invented or tried. The project, the manuscript status stays like this. We are just sending this today to language check and hopefully submit it in the first 2 weeks of September to this journal, which is a D1 called Contraception. About my second project is about investigating the role of obesity and hormonal contraceptives. We know that it is predicted that by the end of this decade, 1 in every 5 women will be living with obesity. And we think that increased body weight might change metabolic processes, also the contraceptive efficacy, and the adverse event incidence. So our aim is to investigate the efficacy and the side effect profile of contraceptive methods in overweight and obese women. The question is that are these contraceptive methods less effective in overweight women or in women with obesity? We had a PICO framework, the women of reproductive age as a population, and we had an even BMI over 25, and we had compared with normal BMI. As outcomes, we check for pregnancies, and as secondary outcomes, we are looking for adverse events. And the hypothesis is that hormonal contraceptive methods are less effective. We performed a preliminary search at the end of November with the following search key. And we are preparing the Prospero registration at the moment. So summarizing, we are planning to submit the manuscript in these days, and then following to finish the next project. I'd like to finish my speech with this quote from William Osler, that medicine is a science of uncertainty and the art of probability. Thank you for your attention.
Nice presentation. I would like to ask that what do you think, how can we improve the compliance of the patients to take the contraceptives?
Well, I think it depends Well, we have to inform patients. We have to inform patients. We have to take time to speak about the side effects, and we have to take the time to offer different methods. And if somebody has an aversion of some type of contraceptive, so they say that I'm very lazy or have a hectic life, I think of myself, I can't take a pill every day. We suggest a ring. If somebody is afraid or telling you that she's afraid of losing the vaginal ring in the toilet or something, then my personal opinion is that we don't give them this, because they will have this constant fear, and if it happens, they will lose the faith in the whole contraceptive, and they will end up pregnant. So somehow like this.
Thank you for the presentation. I have questions regarding side effects. There is confounding literature reported on how the severe side effects of contraceptives, deep vein thrombosis and subsequent pulmonary embolism. How common are they? Have you thought about in your second project checking for these adverse reactions? And what do you think the compared risk is with oral contraceptives and parenteral ones?
Yes, there is the most commonly known is of course, and the most feared one is the thromboembolism, which is not that common as we think. And in these studies, they didn't report it. They reported only 1 or 2 cases. In these cases, it was also reported that these patients, one patient was a weightlifter and using steroids, and also had a genetic thrombophilia. It would be nice to include these, because it would be a great relief to have data that indicates that it is not necessary to be afraid of this, of thromboembolism. So it is not as common as people think, because if you think of contraceptives, mostly if it's an obese patient, so that's what the second project is going to look for, and I think there will be studies with thromboembolism too, because in case of an obese patient, we don't really like to subscribe oral estrogen-containing oral contraceptives due to this fear of these severe side effects.
Thank you.
Thank you.
That would have been my second question, so you shot it down. But my first is, you mentioned the vaginal discharge. Was it related to vaginal ring, or you did find the same result in patch using?
No, it was only investigated in vaginal ring, so they didn't check it for in the patch subgroup. But it had interesting findings. So there was one study that suggested that this increased vaginal discharge might even have a good, a nice effect on the vaginal flora, because it had more lactobacilli in it. But I think women wouldn't really, paying this price, so having a huge vaginal discharge but having good lactobacilli flora is not a price women would like to pay for it. So, but they only checked it in the vaginal ring.
Because always express that vaginal ring doesn't cause any discharge, but we can see that that's not the truth.
Yes, the numbers say it is increased.
Thank you very much.